Hi, my name is Carla Palermo. Today I'm going to talk about the understanding link between sugar, sweetened beverage consumption, and obesity in New York State. Some background on this information: over the past 20 years, there's been a rapid increase of obesity. About 6 out of every 10 adults in New York is overweight or obese. The prevalence of obesity is higher than the Healthy People 2010 objective. Obesity can put someone at higher risk of diseases such as heart disease, diabetes, high blood pressure, etc. Our main objective here was to analyze the link between BMI and sugar-sweetened beverage consumption using a behavioral risk factor surveillance system, also known as the BRFSS 2006 data for the state of New York. The methods. The 2006 behavioral risk factor surveillance system was used. It's a cross-sectional survey on health-related risk behaviors, chronic conditions, and use of preventative services among adults 18 years or older. The data was restricted to New York State. The outcome of interest was body mass index calculated by height and weight. This excluded BMI less than 18.5 or greater than 40. The exposure of interest was the sugar sweetened beverage consumption measured on 4 levels: 0 drinks per week, less than 1 drink per week, 1 to 7 drinks per week, or greater than 7 drinks per week. Complex survey weights applied to all analysis. Simple and multiple linear regression was used to examine the association of sugar-sweetened beverage consumption with BMI, both before and after adjusting covariates. Assumptions were checked by using the CPR plot, residual plot, and QQ plot. No violations were found there. The crude linear regressions and adjusted linear regressions were also used as methods, and this data statistical software version 15 was used to calculate all this data. The covariates that were taken into consideration: sex, age, Hispanic, race, education, income, physical activity, history of cardiovascular disease, and whether you're ever diagnosed with diabetes. The results showed a total of 22,572 participants. The consumption per week, 32% said that there was no sugar sweetened beverage consumption. 28% said that they had 1 to 7, and 19% said they had more than 7 beverages. When broken down into sex, men 59% overweight, 52% of those reported obese compared to 42% of the normal BMI. When broken down in education, we had 41% of the college graduates at the normal weight and 27% of the college graduates that were obese. And the history of cardiovascular disease, we had 5% at the normal weight, 8% reported that were overweight, and 11% reported history that were obese. The unadjusted regression model showed a consumption of greater than 7 drinks per week were associated with an increase of 0.43 units BMI. The adjusted regression model showed that a consumption of 0 to 1 drinks per week were associated with 0.49 units BMI. No physical activity reported in the last 30 days was associated with a higher BMI of 0.73 units, and an association with lower BMI that was true for female non-Hispanic college graduates. In conclusion, with all these findings, there was no relationship between sugar-sweetened beverage consumption and body weight. In New York, there is an association of higher BMI and higher sugar-sweetened beverage consumption. The consumption should decrease to help lower risks of higher BMI, and the public health can benefit from this information to perform further research by promoting healthier habits. Based on some of these findings and research, a proposed research invention, the question would be, would raising the awareness of the sugar content, calories, etc. of the sugary drinks influence healthier choices, and or would taxes on the sugary drinks make a difference? The target population would be adults and youth. The goal would be to reduce the sugary beverage consumption and efforts to reduce the risk of obesity. Educating consumers on what they're drinking and how it affects their body. Objectives would be in a random digit dial health survey of 9,000 New Yorkers were asked, how often do you drink sugar sweetened soda? It was monitored from 2007 to 2013 in adults and children. This was an intervention that was done before. and they showed there was a decrease in consumption, but there's not enough evidence to correlate the two. So in that intervention that I would propose, it would have to do with making more awareness for the adults and youth of what they are drinking, and how that can influence making healthier choices. The social ecological model, how this intervention would play out. The public policy enforcing the stores to include labels with their drinks, possibly taxing beverages that have the sugar content. Within the community, there would be educational campaigns and organizational food policies put forth. On an organizational level, we work on improved educational programs that would be either getting into the schools and making the students aware of what they are drinking, or this could be tailored to the adults, which leads into the interpersonal level, educating themselves to promote healthier behaviors to their children. And then at an individual level, practicing healthy behaviors for yourself to promote a positive awareness. So the intervention would be solely on focusing on education, educating the consumer on what they are putting into their body and the effect that it could have on you, as seen throughout the weeks through this project. You're able to see that consuming a higher beverage could lead to the effects of a higher risk of disease, cardiovascular disease, diabetes, and even the risk of death. Even though we did not find a solid correlation between the two, we do know that some of these do correlate with each other. Thank you very much.